Hi guys, welcome back to sedochealth. Ask the Doctor, a platform where you get to ask all those biting questions concerning your health, and we are here to get you the solutions, to get you the answers. Remember, knowledge is never toxic. A lot of questions have been asked. A 35-year-old lady, her last born is 7 years old, and for the past 5 years, she has tried to get pregnant again, but it has been futile. Another 28-year-old married 3 years ago and has been trying to get pregnant, but all this has been fruitless. I guess you already know what we're going to discuss today: infertility. Welcome back. I'm Dr. Jobo Dodge, and I'm here with my colleague, Dr. Dan Suchunga. You're welcome, Doctor.
Thank you very much, Doctor.
So, infertility. What is infertility, Doctor?
Thank you very much. So to our viewers out there, infertility refers to inability of the couple to conceive a child after trying to have regular unprotected sexual intercourse for a period at least more than a year. Infertility, as we shall see later, can be because a male problem, can be because of a female problem, can be because of both. So we classify infertility as primary and as secondary. So primary infertility refers to a couple that has never had a child before. Whereas secondary infertility refers to the couple that has had a child before but are failing to get their second child. Just like the 35-year-old female you talked about at the beginning.
So, Doctor, what are the causes of infertility in ladies, specifically for today?
I'll start from what we call cervical and uterine causes. The cervix is the opening of your uterus, or the mouth of the uterus. Now, someone could be infertile because the cervix produces a mucus that has what we call antibodies. Antibodies are like soldiers of your body. So now when the sperm tries to come in, these antibodies attack the sperm thinking it's an enemy, and they kill the sperms. Therefore, the couple will be unable to have a child together. It could be that the entrance into the uterus is blocked because of previous infections, because of previous maybe surgeries on the cervix. The cervix has formed scars that have completely blocked the cervix. Now, because the cervix is completely blocked, the sperms are unable to ascend high into the fallopian tubes. Or it could be that at the cervix there is probably a mass or a swelling that is blocking the sperms from entering. So as we have seen, the cervix is our entrance. It's our door into the uterus and into the fallopian tube. So if the door is closed, there is no way the sperms will meet the eggs. So there we leave it at the cervix. Let's look at the uterus as the living room. You've passed through the door, you've entered the living room. Now, in the living room, there could also be problems. Now, what happens in the uterus sometimes is that you find that the living room, maybe the walls are very small, right? That could be because of, again, previous infections, all right? Untreated STIs can ascend through the cervix into the uterus and they cause scars. The walls of the uterus will attach to each other. Sperm again will not be able to move through the uterus to reach the fallopian tubes. Or it could be that maybe within the uterus, again, there's another blockage. Maybe it's a large fibroid occupying the entire cavity of the uterus. After the sperm has passed through the vagina, the cervix, the uterus, it goes into the fallopian tubes. Now, it goes into the fallopian tubes to meet the egg, and fertilization occurs there. Again, I'll compare the tube onto the door. If the door is blocked, there is no way the sperm will enter the fallopian tube. Again, the same, if at all you have a big mass, like a big fibroid, sitting at the corner where the tubes, where the fallopian tubes enter into the uterus, they will cause blockage. And because of that blockage, the sperm will be unable to go and meet the egg for fertilization. And the most commonest cause of infertility among females is actually tubal blockage. I'm sure our listeners out there, you've had a person say, or a relative say, so and so has had a blocked tube, and maybe they've tried some means and have been unable to have a solution. Other thing that can cause the tubes to be blocked is again infections. We have been talking about STIs a lot on this channel. For those of you who have not watched our videos about STIs, go ahead, visit our channel and go ahead and watch our videos about STIs. STIs cause a very big problem when it comes to infertility. STIs, especially gonorrhea and chlamydia, when they go into the tubes, again they leave wounds there. When they cause these wounds will heal by forming scars. Imagine you're walking down the road, you hit your foot against a stone, you get a wound. So that wound will heal by forming a scar. The same happens in our bodies. Now, once these bacteria go and eat around the inside of your tubes, they form wounds. These wounds heal by forming scars. These scars, because the tubes are very tiny tubes, they will eventually be blocked because of the scarring. Now, once the tubes are blocked, the egg will not be able to meet the sperm. Again, it's infertility. From there, I'll talk about the ovary. The ovary is like that basket of fruits. So the fruit is the egg that is going to be fertilized by the sperm. Now, the ovary, once it gets any problem, it is unable to produce the egg. So, for example, someone has had an operation on the ovary, all right? Again, there is healing by formation of scars, or even an infection. You can still have a problem releasing that egg because of scarring. All of you have heard about what you call hormonal imbalance. Now, the ovary in the female is very important in producing hormones. The hormones that make a female are produced from the ovaries. Now, this thing we commonly talk about as hormonal imbalance usually comes from the ovaries. All right? There are diseases that will cause the ovary not to produce enough hormones. So, for example, some females, you find they have a lot of the male hormone more than the female hormone. Because a female has more male hormone than a female hormone, she's unable to have children. Such a female you find that have maybe beards, all right? You find they're usually obese. You find they usually have high blood sugars. The same person still has inability to conceive. We call that polycystic ovarian syndrome. So ladies with polycystic ovarian syndrome tend to have difficulty having children. We can also have ladies who never ovulate at all. About 80% of women will produce one egg per cycle in every month. But then a certain type of women you find they are not having periods at all. Maybe they're having irregular periods and they are not producing any egg whatsoever. If you don't produce an egg, be sure fertilization will not happen, and be sure conception will not be possible. And lastly, there are other causes of infertility. Things like obesity, excessive alcohol intake, cigarette smoking. Ladies who are underweight, who do excessive exercises, tend to have inability in having children. There are also other diseases like endometriosis that can cause someone to have inability to have children.
Doctor, we have looked at all these causes, and especially the interest is you have ever given birth before, but now you are unable to give birth again. What are the things that you can advise our viewers out there to do to prevent secondary infertility?
Prevention against STIs is very important. As we have seen, STIs will eventually cause a blocked cervix, can cause a blocked uterus, can cause blocked tubes. Once there's blockage through the cervix, through the uterus, through the fallopian tubes, it is difficult for the woman to get pregnant because the sperm will not meet the egg. So prevention of STIs is very important. Like we have said in our previous videos, prevention of STIs is majorly hygiene and using protection. If you've not watched such videos, kindly go to our YouTube channel and watch those videos. As we have seen, other risk factors for having infertility are obesity, age, excessive alcohol intake, and cigarette smoking. So cessation of cigarette smoking is very important in curbing infertility. Reduction of alcohol intake is very important in curbing infertility. And also a reduction of weight is very important in curbing infertility. And also I would advise that you try to conceive below the age of 35. Yes.
Thank you so much, doctor. So we have had it all. For every problem, there's always a solution. But we can as well try to prevent these problems from coming in. Dr. Dan here has experience working in a fertility center. He has dealt with a lot of these problems concerning infertility. So stick to this channel. Why? Because the solutions are coming. How can we treat infertility, especially in females, since we have tackled that for now? So never sit on those problems. Ask us. We are here always to answer those questions and to give you those solutions. For today, that is what we have. And remember, subscribe to this channel. Click that bell icon and always get notified whenever we post our new video. Remember, sharing is caring. Don't be Mr. Selfish or Mrs. Selfish. Share this information. It could help someone out there. SeDochealth, ask the doctor.